Hello and welcome to Health Professional Radio. I'm your host, Neil Howard. Thank you so much for joining us. Our guest this evening is returning to speak with us about some findings from the Renal Data System study on which he was an author and how KRYSTEXXA is applied in real-world care for people who've received dialysis for advanced kidney disease. Welcome back to Health Professional Radio, Dr. Brad Marder.
Hey, thank you, Neil. I'm so happy to be here and to be able to tell you about some really interesting results. My name is Brad Marder. I'm the Medical Director for Nephrology at Horizon Therapeutics. Prior to that, I was a practicing nephrologist in Denver, Colorado for 17 years. So as part of the Kidney Week recently for the American Society of Nephrology, we submitted an abstract looking at real-world pegloticase use in patients not just with uncontrolled gout, but also patients who are on hemodialysis. And the reason why this study was important to do is very little is known about uncontrolled gout and KRYSTEXXA use in patients on dialysis. And so we thought by looking through the USRDS database, we could find some interesting data regarding how many patients received pegloticase, what were the circumstances, and so we performed that study. We actually found that there were 42 patients that received pegloticase both before and after they had initiated regular hemodialysis treatments. And these patients largely looked like typical hemo and peritoneal dialysis patients. They were mostly male, as is common in gout. Their most common cause of end-stage renal disease was diabetes and hypertension. And as far as comorbidities, many of them had, in addition to diabetes and hypertension, congestive heart failure, ischemic heart disease, cerebrovascular disease, peripheral vascular disease, and even some with cancer. So this was an interesting study because, as you know, in the pivotal trials using pegloticase, dialysis patients were not included in that trial. And there's often a question that we get from healthcare providers on whether KRYSTEXXA can be used in this patient population. Mm-hmm. Now, we did do a phase 1 trial looking at pegloticase use in dialysis patients. These patients did not have clinical gout, but they were on dialysis, and the point of the trial was to show that KRYSTEXXA as a large molecule is not removed by dialysis, and it remains effective whether or not a patient is on dialysis or not in terms of controlling serum uric acid levels. So we did find, like I said, these 42 patients that had actually received KRYSTEXXA while they were on dialysis. And in addition to the demographic findings and comorbidity findings that I mentioned, we also found one very interesting and unexpected finding. Mm-hmm. As you know, patients with end-stage renal disease often have problems with anemia of chronic kidney disease. This is because kidneys are responsible for producing a hormone called erythropoietin, which stimulates the bone marrow to create new red blood cells. And when patients when patients have kidney failure, they don't make enough of this hormone, and it often needs to be supplemented. Now, interestingly enough, chronic inflammation can actually block formation of new red blood cells, and often patients that have chronic inflammation require higher doses of erythropoietin-stimulating hormone compared to patients that don't have chronic inflammation. Mm-hmm. And so the interesting finding was that when we looked at erythropoietin requirements prior to KRYSTEXXA treatment for their uncontrolled gout, we find that they were higher than their erythropoietin requirements after they completed KRYSTEXXA treatment mm-hmm. for their uncontrolled gout. And this has very interesting implications. In a way, it hypothesizes that the uncontrolled gout itself produces enough systemic inflammation that blocks normal red blood cell production, so that higher doses of erythropoietin are required to maintain hemoglobin levels into the normal range. Now, these findings are completely exploratory. This was a retrospective analysis, and this is not something that we can say that by treating patients with uncontrolled gout, it's clear that their epogen requirements will improve. But this does generate a very interesting hypothesis that we are very interested in studying in further research, because it really does emphasize the fact that gout is not just an intermittent disease of peripheral joints, but it truly is a progressive and systemic inflammatory disease that implicates many parts of the body, potentially including the bone marrow's ability to produce new red blood cells.
Were there any of the subjects whose gout was solely attributed to the dialysis, or did all of them have some degree of gout before going into the trial?
So that's such an important question that you asked, because we know that the diagnosis of gout is much, much higher in patients with chronic kidney disease. And that's because the kidneys are largely the most important mechanism for controlling serum uric acid levels. We know that as kidney function declines, uric acid builds up in the body and then precipitates, and then the body's inflammatory mechanisms react against those uric acid crystals and create those gouty arthritis attacks. So we do know that these patients with chronic kidney disease do have a higher risk for developing gout, but there's nothing that we can say by looking through this database that because these patients have end-stage renal disease, that was the definitive cause of their gout.
Were there any indications that age either benefited or was a detriment to the outcome overall?
So that's actually a very interesting finding. You know, typically dialysis patients are at a higher average age than patients that are not on dialysis. And that's because chronic kidney disease is a slow and progressive condition in most patients with diabetes and hypertension. And so your risk of developing end-stage renal disease older is much higher than it is younger. That said, for these patients with uncontrolled gouts, that required KRYSTEXXA treatment while they were on dialysis, there was actually the highest group was the middle-aged group between 45 and 64 years old. And furthermore, the second highest group was 18 to 44-year-olds, with the least prevalent group being the over 65-year-old group. So it does look like, particularly for dialysis patients with uncontrolled gout requiring KRYSTEXXA, this might be something that happens to younger patients more than it does older patients, according to these data.
Well, where can our listeners get some more information about this study and about KRYSTEXXA and about nephrology at Horizon Therapeutics?
Well, that's very easy. All you have to do is come to the Horizon Therapeutics webpage. We have links to all kinds of information regarding uncontrolled gout, both in patients with normal kidney function and patients with chronic kidney disease. And I just want to remind your listeners as well that Horizon is really interested in advancing the knowledge regarding gout and its treatment in all patients and with all treatment modalities.
I always love talking with you. I love the information that you give us. Thank you so much for returning here to Health Professional Radio this evening.
Neil, it was a pleasure to talk to you and talk to your audience. And I hope that I can make it back here sometime in the near future.
Right, looking forward to it. You've been listening to Health Professional Radio. I'm your host, Neil Howard. Audio copies of this program are available at hpr.fm and healthprofessionalradio.com.au. You can also subscribe to the podcast on iTunes, listen in, download at SoundCloud, and be sure to subscribe to our YouTube channel at youtube.com, Health Professional Radio.